Hello, I'm Pat McGorry, the Executive Director of Orygen, and I'm here to tell you about Orygen, what it actually is. Orygen is a mental health research institute, a translational mental health research institute, which provides a whole spectrum of clinical care to young people in the northwest of Melbourne. But it's really an innovation hub, an innovation laboratory for developing new models of care, new treatments, new interventions in partnership with young people. And there are really four elements to what Orygen has become over the last 20 years since it was first set up. It's a clinical service, an innovative one, covering primary care right through to tertiary care. So we created Headspace as a platform of care and rolled that out across Australia. And we operate 5 of these Headspaces in the northwest here. And we're integrating those with the specialist levels of care funded by the state government here. So clinical care is really a crucial part, but it's really also an innovation hub in which we create new knowledge, new models of care, new interventions through research. And we're not just a normal research institute. We have a whole series of teams working on new knowledge and new skills, but it's research for reform. It's research for change and for developing a whole new field of youth mental health care, of which Orygen is a key vehicle, and there are other vehicles that are being developed both here in Australia through Headspace and in other parts of the world as well. So that's two parts of Orygen. There are two other parts. One is the translational program, which is really about education and training, making sure that the knowledge that we and other people produce in youth mental health is actually translated to the front line of clinical care and into the community so people understand much better what drives mental ill health in young people and the causes of it and what we can actually do about it. And also the skills to actually help young people recover and live their best lives. So that's component 3 of Orygen. And the final one is really important, which is really the engine that has driven the growth and reform in our field, which is the policy and advocacy arm, which is becoming the Orygen Institute. So it's a policy think tank. It's a part of the organisation that basically advocates, persuades, and makes the case for the creation of this new field and its resourcing by government and by the community, and stresses and communicates the importance of youth mental health to the general public. Now, we're pushing on an open door because every family knows that youth mental health is important, but our policy and advocacy arm has been very, very effective over the last 20 years, and that's why that we've seen the base camp level of reform that we actually have both here in Australia and around the world. But there's a lot more to do. And Orygen is the epicenter. It's a crucial vehicle for driving this field forward in partnership and collaboration with like-minded people, both here in Australia and around the world. Orygen began in 2001, emerging from our previously very successful work in early intervention and psychosis. And it was set up as a medical research institute as a partnership between the Royal Melbourne Hospital, the University of Melbourne, and the Colonial Foundation, who basically funded the creation of Orygen and are still key funding partners for us. Over the years, Orygen has grown steadily, around about 8 or 10% a year in our research capacity and influence, and we've gradually strengthened our clinical services. And we're about to enter a very dynamic and transformational phase of Orygen's development, courtesy of the Victorian Royal Commission in Mental Health, which is delivering us governance of the specialist clinical programs previously run by the Royal Melbourne Hospital, but now being fully integrated with our Headspace centres across the northwest of Melbourne. So this is a unique structure, integrating primary care right through secondary and tertiary care, even to statewide and national backup programs. So there's nothing like this in the world, actually, certainly not in Australia, as an epicentre for specialist expertise and knowledge and blending research with clinical care in the way that we do. So we're very fortunate here. We've got wonderful partners, wonderful supporters, and we've got great collaborators across the nation and around the world as well. So we're expecting very, very big things over the next few years. The pandemic's underlined the crucial value of mental health to every person, and particularly young people. the mental health of young people has suffered significantly during the pandemic, and it was already on the slide prior to the pandemic with deteriorating mental health in young people around the world. So youth mental health is probably one of the top public health priorities in the world as we emerge from the pandemic now. And the missing ingredient is the political will and the community support for this huge public health issue to be understood better and to be invested in for the good of everyone, not just the young people and their families, but for the strengthening and well-being of the whole society. So it's a top public health and social priority, which I hope everyone will support us in progressing over the next few years.